Good morning, everybody, from a cold and rainy Kansas City. The day has finally arrived. We've been waiting for this for months, and I'm not talking about the Chiefs home opener against the Texans tonight. I'm talking about the first ever Kansas City Physical Activity Summit. Thanks, everybody, for joining us today. My name is Robin Shook. I'm the director of Weighing In, which is a program at Children's Mercy, and I'm also the chairman of the Kansas City Physical Activity Core Work Group. And I'm happy to welcome you to our Kansas City Physical Activity Summit. While people are coming in and still logging into the website, I'm going to do a couple housekeeping things. So let me pull up my screen. Okay, so while people are trickling in, we can go over some of the housekeeping issues. So the first one is that our website, kansascityphysicalactivityplan.org, is the to-go resource for everything related to the Physical Activity Summit and everything related to the larger Kansas City Physical Activity Plan that we're working on. So if you signed up to receive mailed summit information, you should have received the following things in the bullets: the Kansas City Physical Activity Program, the Kansas City Physical Activity Report Card for Children and Youth, the National Physical Activity Plan, the U.S. Report Card. Those are all also available on our website, kcphysicalactivityplan.org/KCPA Summit. Additionally, on our website, we've got lots of great resources. We've got information on dates and times for future meetings. We've got a few video tutorials related to the Physical Activity Plan and the Summit. So go to our website for all resources related to the Summit and the plan. The Summit program is the document that you can see on this program or on the screen right now. It's a very colorful program that has everything that you need to know about today's meeting, and we're going to reference it several times throughout the meeting. So if you received it in the mail, go ahead and pull it out right now. If not, go to our website and download it. The other item I want to share with you is the Kansas City Physical Activity Report Card for Children and Youth. This is a resource that we've been working on for the past year. It's also available on our website, and we're going to have Elizabeth Wilson talk more about this report card later on this morning. Just so you know, portions of this meeting may be recorded. Please mute your computer during any of the main sessions, but please turn on your microphone during the breakout sessions so we can hear you in the conversation. We also would like you to turn on your camera during the breakout sessions. We understand you might be at home, homeschooling your kids right now or doing other things, so it's okay to turn off the camera during the main sessions, but please, during the breakout sessions, we ask that you turn on the camera. Please make sure that your screen name includes both your first and your last name. And the reason we want to do this is because we will be assigning the breakout sessions based on your name as it was registered on the registration page. And so if you don't have your first and last name, then we can't properly assign you to a breakout session. Breakout rooms have been assigned, as I mentioned, based on the registration. Looks like we might be having a few technical difficulties, so I'm going to pause just real quick while we sort those out. Sorry about the problems or the technical difficulties, everyone. As you can imagine, it is a whole host of new challenges when we're doing a virtual summit as to in person, but we'll make sure that we get through it. So it looks like you can hear me and see my slides again. I'll just quickly go through these housekeeping points again. Go to our website for all of our resources. Everything is kept there. Portions of the meeting may be recorded. We ask you to mute your microphones during the main sessions, but please unmute them and turn on your camera when you're in the breakout sessions so we can both see you and hear you during those conversations. please make sure your screen name includes both your first and last name, because we are going to be assigning the breakout rooms based on your screen names. And we assign those breakout rooms based on preferences you made when you registered for the event. So if you've forgotten what you've registered for, or maybe you didn't sign up for a breakout session and like to do that now, you can put that information in the chat box and we'll try to get you to the appropriate breakout room for later on this morning. Lastly, you should have received, all participants should have received your Kansas City physical activity swag. So hopefully you can use these to not only stay safe, but help spread the message about what the work that we're doing with the Kansas City physical activity. I'd like to thank our generous sponsors who helped us put on this event. And our primary sponsor was the Enid and Crosby Kemper Foundation. They have provided the bulk of the funding for not only the Kansas City Physical Activity Plan and for this summit. We also want to thank Health Resources and Services Administration Region 7 and Children's Mercy Hospital for their generous support of today's summit. I also want to give a special thanks to the following individuals listed here. Sheila Kemper-Dietrich, who has been a great advocate for our work, Rich Overcast, who has supported weighing in Children's Mercy for several years, Sheila Montgomery from Children's Mercy, Matt Kleiman helped create all the wonderful graphics that we're using for not only today, but for the physical activity plan, and Tico Productions, Oscar and Brenna, who are help providing the virtual format for today's meeting. Our core work has really driven the work that we're doing, and those are the individuals that are listed there in pink. And lastly, weighing in is the backbone organization for this work, and that includes Shelley Summer, Emily Meisen-Sebelius, Matt Kleiman, Bryce Miller, and Paige Posson. They have done a lot of work over the past several months to make it. And with that, I'd like to officially welcome everyone to the Kansas City Physical Activity Summit. Hopefully everyone has entered the room now and we've got all of our technology figured out. Today's summit brings together parents, teachers, health professionals, community leaders, and policymakers to collectively make our region a safe and healthy place to live. Our goal today is to share with you the progress that we've made in developing the first ever comprehensive Kansas City physical activity plan and gather your input on how to create a safe and equitable opportunities for physical activity in our region. And we also want to recruit you to join us in this effort. So now we have some special speakers who would like to welcome you to today's summit. Oscar, can you roll the videos?
Well, hi, my name is Bill Cole. I am a professor at the University of Texas in Austin. Dr. Shook has asked me to provide a welcome to the delegates for this virtual conference for kicking off, or at least providing the capstone event for the Kansas City Physical Activity Plan. A lot of work has gone into this over the last few years. I've been fortunate enough to be affiliated with the Kansas City Plan as an advisor, seeing the progress that are coming up with the initial 6 sectors and the work that they've been doing, and hopefully adding the hopefully adding 4 more sectors in the years to come. I currently serve in the Physical Activity Alliance as the chair of the National Physical Activity Plan. Planning for public health is just that. If you don't plan something, things don't happen. If you don't plan to, if you don't plan to take care of, if you don't plan to reduce cigarette smoking, it's not going to happen. If you don't have an action plan to improve health, health will not improve. One of the things that's so remarkable about what you're doing there in Kansas City is there are very few local plans. All health, I believe, is local. And there are very few local plans that specifically address physical activity and its importance in a sector-based approach for improving health. I do want to acknowledge the support, obviously, of Enid and Crosby Kemper Foundation and the HRSA administration, Region 7, to help fund this work. We need more leadership like that. We need more leadership like the people here at this conference. And I wish you all the best in bringing together your sector-based approaches and all of the work you've been doing to lead into the debut of the plan here in the next few short weeks. Best of luck and congratulations.
Good morning and welcome to the Kansas City Physical Activity Summit. My name is Randy Lopez, Vice President of Community Programs for the Wyandotte Health Foundation, and I also serve as President of the Board for the Board of Education for Kansas City, Kansas Public Schools. And I'm delighted to join you this morning and say thank you for taking time to join us for this critical and important conversation. This morning's session brings together so many voices, thought leaders, and providers spanning multiple sectors to discuss ways that together we can improve the physical activity rates across the Kansas City Metro. Now more than ever, we need to encourage physical activity among all age groups. As it is, our communities, especially our lower income and more high-risk communities, may not have the infrastructure that promotes physical activity. And this season of virtual meetings can have us all more prone to sedentary lifestyles. If we're not careful, the entire day might pass us by, and the only movement we've had is from our desk to our refrigerator. But I especially think about our students. In Kansas City, Kansas Public Schools, we'll be doing remote learning for at least the first 9 weeks. And for them, we need to find ways to get them up and bouncing around again, using that energy that they have to move rather than just sit in front of a computer screen all day. But we can't do this alone. We can't expect that working parents and families have all the resources and tools necessary to get their kids, even themselves, moving. And we know that in an urban setting, it can be difficult for families to access safe and affordable ways to promote activity. The inequity in access is unconscionable. And in Wyandotte County, we ranked 104 out of 105 counties in the county health rankings from Robert Wood Johnson Foundation, including a physical inactivity rate of 33% and an adult obesity rate of 40%. And we know that this disproportionately affects our low income and Black and brown families. Unfortunately, this isn't isolated to Wyandotte County alone. We are all in this together. But I also know this. I know that our community is resilient. We are strong and we are hopeful. The richness within our diversity is one of those things that makes us a proud community and a thriving community. But we need to work collectively to strengthen and support those working families to promote physical activity. At the foundation and at the district, we know that this involves multiple people, multiple sectors, and that there's no one way to do this. It involves all of us creating that culture of health and investing in an environment that promotes physical activity. And most importantly, to nurture those relationships that encourage one another to get moving. Let's not forget that the solutions lie within our community. And together, we need to work with our residents to come up with those creative ways to get our families jumping around again. So thank you for coming together to do this amazing work. Today is just the beginning as we discuss how you, your organizations, and all of our different sectors, including our public and private, our social service, education, health, civic, faith, and philanthropic entities can come together to not just discuss, but put a plan to action that will build the path to physical activity in Kansas City. And I can't wait to be part of this process with you. Gracias and adelante.
Hi, my name's Eric Bunch. I'm the 4th District City Council person for Kansas City, Missouri. My district covers downtown, a little bit of the Northland, the Plaza, Westport, a little bit of Brookside, and the historic Northeast. It's a great district and a great city, and I'm excited to welcome you all to the Kansas City Physical Activity Summit, which is a really important activity, important day, important event for us to come together and talk about how important it is to make sure that our area's kids and adults can get out and be more physically active. As a policymaker, this is really important to me. It's actually one of the main reasons why I got interested in local politics, is because down at City Hall on the 26th floor of City Hall, where we make our local laws, is one of the things that's what's great about where we make those local laws and what we do is that we really address the things that you experience the second you walk out your door, which really impact your ability to get out and walk, experience nature, ride a bicycle. And so I ran for office because I wanted to make sure that we as a city were doing better, because it all really starts at the top with policy, a good policy that's supportive of physical activity. And it starts really and starts with policy, but then it trickles down to how is our environment built? What is the built environment like? Is it accessible for everyone, regardless of physical ability, regardless of race or gender? And unfortunately, we know that that's not always the case. And even within my own district, going from one neighborhood to the next could mean a serious difference in the quality of sidewalks, the existence of crosswalks or bike lanes, how easy it is to get to the park. And once you get to that park, what's the quality of the equipment there? What's the quality of the walking or hiking trails there? And seeing that within my own district, you can imagine how that may differ across the entire city. And so one really important factor about all of our policymaking around physical activity and built environment is it equitable? We have a lot of work to do. And I think this summer, in the midst of a global pandemic, which is why I'm here instead of in person, but also with the civil unrest around truly addressing systemic racism that exists in our communities. And at the policymaking level, that's more clear than ever. And so it's my goal to make sure that regardless of what neighborhood you're in Kansas City, that every kid has the ability to walk safely to school. Every family can get to a park with ease by walking or biking, and once they get there, that their park is in great shape. That public transportation is adequate and gets people to jobs, and that we have accessible bike lanes that are safe and kept clear of debris. Because when the environment that we experience every day is accessible for everyone, it becomes a better community for all of us. And so I think that really has to start with equitable policymaking and adequate funding for our parks, trails, sidewalks, bike lanes, and better, safer streets. And so I am excited to be a small part in the Physical Activity Summit, and I hope that you all have a great day today, and that you take away some really key things, and that we come back to all of this that we've learned and truly act upon it. And I want you to know that I'm a big champion for the systemic change that we need to make physical activity a reality for everyone's everyday lives. And I want you to hold me to that. So please don't hesitate to reach out to me in the future. And I look forward to what comes out of this. And I look forward to some big changes and some big opportunities and some big ideas to come from this. And one day when we all can emerge from our offices and join together again in our each other's physical presence, I look forward to really getting down and to doing some really great work and getting together with you all. So again, welcome and good luck and have a great day today. Thank you, and we'll see you out there.
Good morning, everyone. I'm Councilwoman Raina Park Shaw, Councilwoman of Kansas City's 5th District, and I'm absolutely delighted to be a part of this very impactful and necessary convening. You're logged on to this working session because you have a deep passion and concern for creating a better and healthier future for our children. I'm also passionate about creating a healthier Kansas City, When I learned that vast difference in life expectancy for residents in the Fifth District compared to residents in other parts of town was drastically different, up to 20 years, I knew I had to do something. And I ran for office because I believe that no one's life should be cut short simply because of their zip code. The work that you are doing today via the Kansas City Physical Activity Plan is one way that we can proactively tackle the life expectancy disparities by instilling healthy habits in children early enough that they can grow into health-conscious adults. As a co-chair of the Kansas City Health Commission, I'm dedicated to finding innovative and creative solutions to address our health issues from a public health approach. Like the structure of the Health Commission, the Kansas City Physical Activity Summit is another way that we can collectively work together across sectors to address child health. We have a diverse audience today made up of educators, faith leaders, healthcare professionals, and so much more. Together with your various backgrounds and expertise, I'm confident that we can work in our respective fields to address and remove the systematic and racist barriers that make it difficult for our children to be physically active. In my role as 5th District Councilwoman, I'm working to get more sidewalks and safer neighborhoods so that our residents and our children can exercise without fear or environmental barriers. The Kansas City Physical Activity Plan has a reach far greater than my jurisdiction as a Kansas City Councilwoman. In fact, your work will be implemented across 6 counties, impacting the lives of thousands of children. And I can't wait to see the results of your work today and look forward to identifying ways in which my office can support your efforts. Thank you for your hard work and have an awesome day.
Wow, well, thanks for to all of the opening speakers for those welcoming remarks. I think it's a really strong statement of support for the Kansas City Physical Activity Plan that we had 4 great leaders in this field lending their support. And in case you missed their names again, we had Dr. Bill Cole, who's a professor at the University of Texas in Austin, who is the chairman of the National Physical Activity Plan, which we modeled our work heavily on. You may remember Dr. Cole if you attended the Systems of Childhood Obesity Summit that we had 2 years ago. He was one of our keynote speakers. We also had Randy Lopez, the board president of the Kansas City, Kansas Public Schools. And from the Missouri side, Eric Bunch, councilman from the 4th District, and Councilwoman Rihanna Parks-Shaw from the 5th District. So thanks again to them for lending their support to the work that we're doing. And now that we can actually begin the program, I'd like to show you our agenda. This agenda can be found in the Summit program on page 3. So if you received the Summit program in the mail, this is what it looks like. You can also find it on kcphysicalactivityplan.org. So at 9:30, we're going to have our first sector work group. 10 a.m., we're going to have a physical activity break. 10:15, we are going to have our keynote speaker featuring Kelly Cornett from the Centers for Disease Control and Prevention. 11 a.m., we're going to have our second breakout session, and at 11:30, we'll begin to wrap things up. So to begin with, I think we should talk about why do we need a physical activity plan in our region? And I think it really comes down to 4 simple points. Number 1, physical activity is one of the most important determinants of health that there is. That being said, most Kansas City residents, young and old, do not attain sufficient levels of physical activity. How do we address these insufficient levels of physical activity? Well, it can't be done through any single program or policy. Instead, we need collective action across all sectors of society to create meaningful change. And we think the Kansas City Physical Activity Plan is a way to do that because it's multi-sectorial and a collaborative approach. Now, before I explain more about these 4 points, I think it's worthwhile to take a look at one of my favorite paintings. This painting is from 1560 from Peter Bruegel the Elder. It's a great name, and it's titled Children's Games. There are actually 230 children doing 83 different games in this painting. I want you to just take a minute, look at the painting. I know it's a little small, but lean in, squint, and write down the first impressions you have when you're looking at this painting. And feel free to put what your impressions are into the chat box. I've looked at this painting hundreds of times. I used to have it in the break room of where I used to work, and so I would see it every day when I would get my mail and microwave my lunch. And so I've seen just about every piece of this multiple times. And every time I look at it, I think of something different. And some things, I'm looking at the chats right now. There's lots of great comments. As it relates to today, maybe because I'm in the mood around comprehensive physical activity plans, the impressions that I had were, it looks like this main building back here. You can kind of see my highlighter. I'm not sure exactly what it is, but it looks a little bit like a church. And so we'll say it's a church, and there's children and adults playing all around the church, in the church, hanging out the windows of the church. In the foreground, there's another building. I'm not sure exactly what it is. There's a pen there, which may suggest it might be maybe a school, and that's a play yard, or maybe it's a store. But either way, there's lots of children and adults in all parts of the store doing different types of activities. In the street, there are games being played. Up the street, there's games being played. Over by the river or the stream, there's more activities going on. And I see sports being played. I see free play or just active play, imagination being occurring. I see boys, I see girls, I see young kids, I see adults, I see individuals doing activities by themselves. I see groups of people doing activities together. And I think that this, it's just a painting, but I think it is a powerful image for the work that we're trying to do. And I'm not the only one that thinks this. In 2012, The Lancet, which is arguably the premier medical journal in the world, had a whole issue devoted just to physical inactivity. And on the cover, they chose that same painting. And below it, there was a quote: "In view of the prevalence, global reach, and health effect of physical inactivity, the issue should be appropriately described as a pandemic with far-reaching health, economic, environmental, and social consequences." That's a very strong statement. And it was written none other by the first person to give a welcome address, Dr. Bill Cole. And so that's a good lead into my first point. And that is, physical activity is perhaps the single most important determinant of health there is. It would be hard to find another variable that has as much clear and consistent positive health benefits as there is for physical activity. And there is really no argue or debate about this. Now, some academics will debate as to whether what is more important, being active or reducing sitting time, things like that. But really, I think it doesn't really matter. And that is because of this graph. This is the only health statistic that I'll show you for the rest of today. But this is a graph showing both the relationship between mortality, how long you live, and the relationship between your level of physical activity, time sitting, and fitness, which is usually measured through a functional test. And on this horizontal axis, you can see the different variables related to sitting, fitness, and physical activity. And on the left is the lowest amounts. So the most sitting 100% of the time, low fitness, or 0 minutes of physical activity. Going towards the right, you see increasing levels of all of those things. On the vertical axis, you see the risk for mortality. And so if you have a risk of 1, that means you have a 100% likelihood of dying. And if you have 0.8, that means you have an 80% or a 20% reduction from 100. So the first thing you see is that there is a clear benefit to being physically active. It's about a 60% or a 40% reduction. But what is most striking is most of the benefits occur from moving just a little bit. So if you go from 100% of your time sitting or low fitness or 0 minutes of physical activity to just 75 minutes of sitting, low to moderate fitness, or this is equivalent to about 20 minutes of walking a day, you will see a reduction in death by about 25%. So most of the benefit comes from just moving a little bit. So how do we get people to move just a little bit? Unfortunately, most Kansas City residents get low marks for physical activity, and the environments they live in do not support physical activity either. So this is information that Elizabeth Wilson is going to be sharing in just a little bit, so I won't spend a lot of time on it. But obviously you can see for overall physical activity, this is for youth, we get a grade of a C-. The best we've done is in organized sports participation. The worst is active transportation, where we got an F. So we clearly have lots of work to do. No single program can address all of the barriers that exist for physical activity. And we talk about the ecological model of health in academic circles. In very simple terms, it means that someone's behavior is influenced by lots of different levels of influence. And so if we imagine a young boy in the middle of this big, complex ring of circles, what determines whether he's active or not? Well, one level is how he perceives his environment. Does he think it's safe to go outside? Is it attractive to go outside? Then we can zoom out and let's look at actually his neighborhood. Are there facilities for him to go for a walk or ride a bicycle? And then we can zoom out even further to the policy environment that he lives in. Is there incentives to have healthcare or to do preventive health? Are there public recreation policies in place that make it easy to be active? Are there park policies in place to provide opportunities to be active in parks? So there are a whole host of influences that determine whether this boy is physically active or not. And so to create an environment that is supportive of physical activity, we have to work in a multi-level collaborative way. And that's where the Kansas City Physical Activity Plan comes in. It is a multi-sector approach to creating safe, equitable opportunities for physical activity in our region. It consists of 10 societal sectors that develop specific strategies and tactics to create opportunities for physical activity. Our work is based largely on the National Physical Activity Plan, which was developed in 2010 and was updated in 2016. And the plan is a comprehensive set of policies, programs, and initiatives designed to increase physical activity in all segments of the US population. The national plan aims to foster a national culture that supports physically active lifestyles. And I think culture is the key word there. Now, one of the key priorities of the national plan is for states and local municipalities to create their own targeted physical activity plans. Here is an example of the strategies and tactics from the national plan. I just picked healthcare because I work in the healthcare industry. So the national plan has identified 4 strategies to create opportunities for physical activity in healthcare. These are developed by expert panels across multiple disciplines, and they are informed by public comment and they're evidence-based. Let's look a little bit closer at 2 of these strategies. So strategy 3 is healthcare systems should partner with other sectors to promote access to evidence-based physical activity services and to reduce health disparities. So to do that, they identified 7 tactics to achieve that strategy. One that I highlighted with the arrow is to partner with community physical activity services to form referral networks. So basically you go to a doctor, your doctor says, hey, I think you could be more physically active. Let me refer you to the local YMCA, and they are waiting for you to start your physical activity program. Strategy 4 is that universities, training programs, and professional societies should include basic physical activity education in the training of healthcare professionals. So they identified 5 tactics to achieve this strategy. The first one, which I've highlighted with the arrow, it says, include basic physical activity education during assessment, brief counseling, and referrals as part of your curriculum in medical school. So we have 3 medical schools within the Kansas City region. Wouldn't it be powerful if we could get all 3 of those medical schools to have physical activity education as part of their curriculum? We would train a huge number of healthcare professionals before they enter the workforce. So the goals of the Kansas City Physical Activity Plan are to create Kansas City-focused, sector-specific strategies and tactics to foster a culture of physical activity lifestyles. There are also 3 other important goals of our work. The first one is very straightforward. There are lots of public health challenges facing the Kansas City region right now, from gun violence to COVID-19 pandemic, but that doesn't mean that we can just ignore other public health emergencies like physical inactivity. And so by coming together collectively, we can make a statement that physical activity is a public health priority in our region. Second, by creating a multi-sector coalition, we can advocate for priorities that we identify in the physical activity plan to help move our movement forward. But it doesn't just stop with the work of the Kansas City Physical Activity Plan. It is always a good idea to engage multiple sectors when doing any type of public health work. We've got to work with, healthcare has to work with faith institutions and schools and parks and recreations to make any type of broad systemic change. And lastly, we want to create a framework for implementation of the strategies and tactics that we identify. There is nothing more that we would like is if we develop a plan and then in 2 years, someone who wasn't at this meeting, has never heard of our work, stumbles upon our plan and identifies a strategy and tactic that fits within their organization or neighborhood group. And they say, hey, we're going to take this plan that someone else identified and we're going to run with it. We want to make it easy for people to do this work. Additionally, we have 3 overarching strategies or priorities. The first is to increase local funding for physical activity initiatives. We need funders who are based locally to support this work to create opportunities for physical activity. Second, we need to have regular comprehensive surveillance of relevant physical activity metrics, and we need to report out those surveillance outcomes in the form of a physical activity report card. And Elizabeth Wilson is going to talk about that in just a minute. We have 4 guiding principles for the work that we're doing. And those are, and these should inform every strategy and tactic that we develop. We want equitable access to safe places for physical activity. It has to be an evidence-based approach. It has to be community informed, and it has to address system-wide policy and environmental change. It's okay to do some work within a very specific region, but we have to address the whole system if we want to make lasting change. And so what have we been doing in this process? In November 2019, we launched this work by forming the Kansas City Physical Activity Plan Core Work Group. And I'll show you these, the members of the core work group on the next slide. In somewhere around March 2020, right when the pandemic was hitting, that's when we started extending our work to the community. So that was engaging stakeholders of multiple different sectors in a variety of different ways. You'll learn more about these engagement efforts that have been done in the sector breakouts, because each sector handled this in its own specific way. In September, today, we are officially launching the Kansas City Report Card. That's what Elizabeth Wilson will be talking about in just a minute at the Kansas City Physical Activity Summit, which is what we're at today. And so today, we're going to engage more stakeholders than we have in the previous 6 months and get their input on the work that has been done. Later this fall, we will release the first edition of the Kansas City Physical Activity Plan in the 6 sectors that we've already engaged. Additionally, this fall, we are going to launch 4 new societal sectors that we didn't launch when we began, simply because of resource limitations that we have. Additionally, we will begin implementing the strategies and tactics that we identified in the first 6 societal sectors. That work will continue between fall 2020 and fall 2021. And that is when we will release the second edition of the Physical Activity Plan, which includes all 10 societal sectors. And then going forward, we will continually update the Kansas City Physical Activity Plan. We consider it to be a living document. We will update it as we see necessary. We will have pre-identified intervals where we will do a structured update of the physical activity plan, likely every 5 years. Additionally, we will also repeat the physical activity plan report card again every 5 years. So with that, I would like to return to the Kansas City Regional Report Card on Physical Activity for Children and Youth and learn more about this work. And to do that, I'm going to hand it over to Elizabeth Wilson. Elizabeth Wilson is a member of the weighing in team. She has spent the past year doing all of the work related to the regional report card. So, Elizabeth, I'll hand it off to you.
All right, thank you, Dr. Shook. I am really happy to share this report card with everyone, and I'm going to be just giving a pretty brief overview of the report card and get you an idea of how it works today. So first, I'd like to give a little background to the report card. It's based on a national report card, the U.S. report card on physical activity for children and youth. So that report card assessed 9 indicators of physical activity, and they assign grades at the national level for how we're doing in each of those indicators. They repeat this report card every 3 years, so the most recent report card was published in 2018. We, like I said, modeled our report card on that national report card using the same 9 indicators of physical activity in children and youth. But of course, we had a local focus to this report card, and so we evaluated how we're doing in the region on those 9 indicators. And this had two goals. Largely, we want to establish those current rates of physical activity so we have a sense of how we're doing. And this will also allow us to, as Dr. Shook said, continue monitoring at regular intervals. So hopefully we'll be able to see change as we implement the Kansas City Physical Activity Plan. So now just a little background on how we went about creating the report card. We had that regional focus, and so largely the data in the report card is looking at 4 counties in the Kansas City metropolitan area, so Clay and Jackson in Missouri, and then Johnson and Wyandotte counties in Kansas. There's some data that's available for a couple other counties, Cass and Platte in Missouri, but for the most part, this is going to be representative of those 4 counties. Again, we use the same 9 indicators and the grading criteria from the national report card. So the national report card assigns a letter grade in each of the indicators. I'm sorry if your screen's a little blurry, but you can see all of this in more detail at the KCPA website. But this grading scale is an A to F or incomplete scale, and a letter grade corresponds to an approximate percentage of how many children and youth in the area are meeting standards in that given indicator. We added a piece to our report card that's not present in the national report card. We noticed that some data sources were not evaluating criteria thoroughly, and in other cases, they were missing important qualities that would make a good data source. So we evaluated data in every indicator. You can see here that there are 5 standards we identified as important to a good quality data source, and we assigned a letter grade just based on how many of those criteria they meet. So we assigned initial grades with consultation with subject matter experts who allowed us and gave us information on sources we may have missed or information to consider when assigning our grades. And then we discussed with the Kansas City Regional Physical Activity Plan core work group. As a large group, we discussed the grades and got a final grade assigned back in March. So I'm just going to walk through one indicator with you guys today, and really I want to give you a sense of how to read the report card and how to make it useful to yourself. So we'll just talk through the overall physical activity indicator. And I've got it laid out here, but we'll go through each section in more detail. So at the top of every indicator, you'll find the actual name of the indicator and the primary criteria that is used to assign a grade in that indicator. Some indicators will have more than one criteria. They'll be called secondary criteria. In this case, there's only one criteria, the primary criteria. So that is the percentage of children and youth who meet the physical activity guidelines for Americans, recommending that children and youth accumulate at least 60 minutes of daily moderate to vigorous physical activity. So then you'll see the indicator grade, and that grade is based on the data that assess the criteria. You'll also find the data quality grade, and that assesses the quality of the data used when we graded the criteria. Below the grades, you find the key findings that support the grade we assigned. So for example, we have this data point that 42.5% of children in the area were active at least 60 minutes of every day, which corresponds to that primary criteria used to evaluate the grade. And that supports that letter grade of a C-. There's a couple other key findings, and then below that, you find other considerations. So other considerations are data that are relevant in this indicator, but do not directly align with the criteria, or in some cases are not at the local level. So while they provide information and nuance to our understanding of the indicator, they're not represented by the letter grade that you'll see. On the next page, we go into a more in-depth discussion of the indicator grade. We talk about the local data that we used evaluating the grade, as well as synthesizing findings from the national level, and in some cases discussing the additional considerations that were presented. We also discuss the data quality grade. So we'll go into the source that we used to assign our grade and talk about the qualities of that data source and why we assigned the grade it was given. We also do the same for any other considerations that are present in an indicator. So again, we just review what was the source used and what are its qualities. Finally, every indicator is going to conclude with some recommendations. We like to focus a couple recommendations on how to improve the surveillance of a given indicator, because as we went through this process, we realized surveillance could definitely be improved. And we also talk about ways to improve the way we're actually doing in the indicator, how to improve, for example, overall physical activity for children and youth in the region. So here you have the report card itself, as Dr. Shook has already shown you. You can see all 9 indicators there and the grades and data quality grades for each of those indicators. I'm going to draw your attention to the website at the bottom of the slide. If you can't read it, it's kcphysicalactivityplan.org/KCPA-report-card. So at that site, you'll find the full report card, the full document, which goes into a very lengthy discussion for each indicator, as well as a pre-recorded video that I did where I go through each of the indicators in much greater detail. So that's where you can kind of browse and find the information that's helpful to you. You'll also in the future be able to find links to each of the data sources that we used in the card. So that can be really helpful. We hope that you'll use this report card as a way to collect information that's helpful for you in advocating for the work that your organization does, for applying for funding, and just to monitor how we're doing at the regional level in physical activity. So that's all I've got for you guys. I really appreciate the time that you've taken to attend and listen to me, and I'm going to send you back to Dr. Shook.
Great. Thank you so much, Elizabeth. That was a wonderful summary of the Kansas City Physical Activity Report Card. As Elizabeth mentioned, I understand it can be hard to see some of the graphics on both through your internet connection and on a small laptop or something like that. So please go to kcphysicalactivityplan.org to find and download the full report card. It's going to be a great resource. I think it's going to be a great advocacy tool for the work that we're doing. Additionally, it's going to be a great way to find local health statistics. As Elizabeth mentioned, we have compiled all the local data that exists and put it in, and we'll put it in one spot. Just before we get off to the breakout rooms, I'm going to do a quick introduction of the sectors and who's leading them. So all of this information can be found in your Kansas City Physical Activity Summit summary and agenda on pages 10 to 25. So please, if you had it delivered to your house, open it up. If not, go to the website and download it, because we'll be referencing back to it both in the breakouts and later on in the program. So as I mentioned, we have 10 societal sectors that we have identified in the physical activity plan. The first is infrastructure, and the co-leads for this group are Laura Steele from Bike Walk KC and Maggie Green from KCMO Public Works. They're supported by Matt and Bryce from Children's Mercy and weighing in. Early childhood is led by Rhonda Erpelding, and she's supported by Emily Meisen-Sebelius. Healthcare is led by Dr. Jody Dickmeyer of Children's Mercy, and that group is supported by Shelley, myself, and Paige Posson from weighing in. Faith-based is led by Reverend Eric Williams from the Calvary Community Outreach Network and Carol Bo Thompson from University of Missouri, Kansas City. That group is supported by Shelley Summer. Healthy Schools is led by Michelle Dake from KC Healthy Kids and supported by Emily Meisen-Sebelius and Elizabeth Wilson. Parks and Rec is led by Roosevelt Lyons and Jen Jude from KCMO Parks and Recreation, supported by Matt Kleinman. And the other 4 sectors, youth sports, public health, business, and media, have not yet begun. They will be launched in fall 2020. Youth sports will actually have their first meeting during the second breakout session today at 11 a.m. So if you signed up for youth sports or are interested in youth sports, join us for that breakout at 11 a.m. And I'll be leading that group for the purposes of today. So we've now reached 9:30. So we will head into our first breakout room. Now, just as a reminder, your breakout rooms are pre-assigned based on your interest area from registration. So you've got to have your name, first and last, in your Zoom username so we can properly assign you. Additionally, if you're joining us today on a phone, it's a little bit more challenging to join the breakout rooms. But if you can find a way to put in your phone number and your name in the chat box, we can try to send you to the appropriate breakout room. It's a little bit harder on a phone, as you can imagine, but we'll do our best to make it work. Okay, so when we head into the breakout rooms, you'll automatically be sent into the breakout rooms. You'll be there for 30 minutes, and then you'll automatically be sent back into the main room. So you don't have to join a room or leave a room. This is all pre-done ahead of time. If you're having any problems, feel free to use the chat box to communicate with us. Okay, now I'll ask Tico Productions, are we ready to go to breakout rooms? All right, you should get whisked away any minute now.
Hey, good morning, everyone. This is Richard Overcast with the Health Resources and Services Administration. Thank you all for joining us. For the folks that are still sitting in the main room here, the reason you're still sitting in the breakout room is we only have a phone number for you, and we have a registration report to get folks in the appropriate breakout room. So without your name, we're unable to get you into that appropriate breakout room. So what we're going to do, if you could just indicate in the chat room which breakout session you would like to go to, we can pull you into those appropriate breakout rooms that way. So we'll just give everybody a second here for if you have a phone number. So if you look at your screen name, if you just dialed in, you know, if you've got, like, for example, I just saw a 913 number. If you've got a phone number and not an actual screen name, just put in the chat pod which one of those 6 breakout sessions you would like to go to. Hey, good morning, everyone. This is Rich Overcast again with HRSA. We've got a few people that are still unassigned, not in breakout sessions. If you would like to join one of those 6 breakout rooms, if you could indicate in the chat, just tell us which breakout session you would like to go to, and we'll get you there. You're also welcome to just hang out in the main room, as we will be coming back to the main room in about 20 minutes or so for the keynote speaker and a couple other items. So, but we will jump into breakout sessions again later this afternoon. So kind of keep that in mind. If you're not in a breakout session now and would like to join one, just indicate that in the chat. We're kind of standing by and monitoring that. We'll get you in the right place. Thank you.
Hi, everyone. This is Shelley Summer. I hope you had some great discussion. I know we did in the faith-based setting. It seems like that time really goes fast. So we want to take a little bit of a break. This is your opportunity not just to grab a drink, use the bathroom, but it's also an opportunity for some physical activity. I want to introduce Mackenzie Helmick. She is the program manager at Corporate Fitness Works, which is the organization that supports Children's Mercy's Fitness Center. So I'm really pleased that she agreed to lead us in a stretch flow. You can do that standing, sitting, however you see fit. And I'm going to turn it over to Mackenzie. Thanks, Mackenzie.
Thank you, Shelley. Hi, everybody. Thank you so much for having me. I'm really excited to lead you through this quick stretch break. So if you're able, go ahead and stand up with me. If not, you can always do these seated in your chair. So we're going to go ahead and get started with just a few neck stretches. So I'm going to have you place one hand on the side of your head and place some gentle pressure. Allow that trap muscle to relax. Take a few deep breaths. And whenever you're ready, we'll go ahead and switch sides. Same thing on the other side. Gentle pressure, push down. Let that trap muscle relax. Few deep breaths. And then we're going to move to behind the head. Interlace those fingers behind your head. Pull the elbows forward and down. Round out the back of your neck. And then kind of rock side to side if that feels good to you. And whenever you're ready, look straight forward. We're going to open up those elbows, pull them straight back together, and then move into some torso rotations. Again, make sure we're focusing on our breathing the whole time. Good. And then we're going to bring the arms down, and then one arm up and over for our flat stretch. You should feel this all the way through the side of your body. If it helps, you can always grab the wrist and pull. And then same thing on the other side whenever you're ready. If you want, go ahead and grab and pull. Bending at the waist. All right, good job. We're gonna go ahead and move to lower body. So this might be the only stretch you might need to stand up for. We're gonna do our quad stretch. So if you're able, go ahead and grab that foot, hold on to something if you need to. If you're not able to grab your foot, go ahead and place it on your chair at a 90-degree angle and then push that head forward. You should feel this one all through the front of your leg, all the way up through those hip flexors. Really pull that heel towards your bottom and push the hips forward. And then whenever you're ready, we're going to move into a hamstring stretch, taking that same foot, swing it forward, heel down, toe up. Let's reach down for those toes for a hamstring stretch. Should feel this all the way throughout the back of your leg. If you're seated, just go ahead and move to the end of your chair. Reach down for those toes. And whenever you're ready, go ahead and roll up. We're going to switch, do the same thing on the other side. Back to that quad stretch. Grab the toes, pull the heel in towards your bottom. Really push those hips forward. You should feel this all the way through the front of your leg. And then swing that leg through, heel down, toe up. Reach down for those toes. Hamstring stretch. Go ahead and come up whenever you're ready. This next one we're going to move into is our glute stretch. If you're seated for this one, again, go ahead and scoot to the edge of your chair. If you're standing, we're going to go ahead and cross the leg over, squat down, hold on to something if you need to. And we're going to apply gentle pressure to the knee. Whatever leg you have crossed over, that's the glute you should feel it in. If you want to take this one up and make it a little bit harder, go ahead and grab that foot, pull up. And let's switch, other side, same thing. Cross that leg over, drop down, gentle pressure on the knee. Still focusing on our breathing. And if you want to make it a little bit more difficult, go ahead and grab the foot and knee and pull up. All right, good job. We're almost done. We're just going to do some quick forearm stretches. Pull those fingers back and down. I know we all do a lot of typing. And then switch sides.
Robin.
And fingers up, pull back. Other side, fingers up, pull back. Give it a few rolls. And our last one, I always like to end with this one. Interlace those fingers, push out, round the back, rock side to side. Go high, go low. And whenever you're ready, all the way up. Stick that belly out, big belly stretch. And then if you're standing, go ahead and fold over. Relax as best as you can. If you want, you can grab those elbows, rock side to side. Get a nice low back stretch. Big deep breath. And then roll back up. And that will finish out our stretches for today. Thank you so much for having me, guys.
Thanks, Mackenzie. That was awesome.
Thank you.
We so appreciate it. You can point out my favorite bike back there too if you want.
Yeah, right over here. That's where she lives.
It's so nice to have you guys so conveniently located. Well, thanks again for leading us through that stretch. We like to role model, practice what we preach, include physical activity breaks in our conferences. So we have about 10 minutes before you join us again. So feel free to get up, walk around, get something to drink, and we'll see you back in about 10. Bye, Mackenzie.
Bye.
Welcome back, everybody. Thanks so much for that physical activity break. Excuse me while I close these out. Thanks for doing that physical activity break. I hope you stretched out a little bit, went to the bathroom, refilled your cup of coffee or water, and are ready for our keynote speaker. We are so excited to have one of the best speakers we could have gotten for this conference. Her name is Kelly Cornett, and she is with the Center for Disease Control and Prevention in Atlanta, Georgia. And anyone who knows this type of work in terms of physical activity and public health knows that the Centers of Disease Control and Prevention is the leader in the world for this type of work. So we're ecstatic to have Kelly. Kelly is a health scientist on the translation and evaluation team in the physical activity and health branch within the Division of Nutrition, Physical Activity, and Obesity at the CDC. She collaborates with partners to promote physical activity at the population level while participating in research, partnership development, and technical assistance. With an educational background in exercise physiology and health promotion, Kelly uses her communication skills to synthesize evidence-based research into messages, resources, and promotional materials related to physical activities to support walkable, active communities. So with that, give a warm virtual welcome to Kelly Cornett. Hello, Kelly.
Hi, everyone. What a virtual world that I can be with you all from Atlanta. This is amazing. Thank you for the kind intro, Robin. And I am pretending that I see all your wonderful faces out in the computer verse here as I look at myself on a screen. But thank you so much for having me. And I am actually going to start my presentation. I'm going to share my screen for y'all. All right, let's see. There we go. And we're good to go. I see thumbs up. This is awesome. All right, so I am just feeling really honored to be here. Physical activity and health is my passion, and I've been working in it for many years. But I work right now with the Centers for Disease Control's main initiative for promoting activity-friendly communities, and that's called Active People, Healthy Nation. And I know that I'm speaking to friends because I've seen your physical activity plan. I know you all are on the same page when it comes to this as a priority. So I'm very excited to share with you the national initiative that aligns with your goals. And in this session, I'll discuss the CDC's strategies to increase physical activity and highlight how cross-sector collaboration is really key to our national initiative and how you are a huge part of that work by doing what you're doing with this summit. So moving on, before I get started, I do want to know a question about the audience. Since I can't see you all, I need to know with a poll that pops up here, what motivates you to be physically active right now? And there's a couple different options there. So go ahead and try to select one if you had to choose one main reason in your current context, in your current community, what motivates you to be physically active? I'm always curious about this. All right. And I think we'll be able to see the results. I'm going to look to my production crew for sharing the results. 5, 4, 3, 2, 1. All right. All right. So I'm looking to my crew here. Do we have some of the results for the top answers coming through?
Hi, Kelly. I can read some off for you.
That would be awesome. What are we coming in with the top?
Number one is with 47% is it's what I do normally.
Oh, wow. All right.
Second, at 28% is stress relief.
Yep, right there
And
with ya.
And then kind of tied at about 6 or 8% is my fridge and I were getting too close. I needed to go outside to see people, even if only from a distance. I'm having more trouble than usual fitting in physical activity, and I'm having trouble getting motivated.
Awesome. Thank you, Robin. Okay, well, I'm right there with you with the fridge situation. So I feel like we're all in the same boat on that. However, the fact that you have almost half of you in the room, this is what you already do. I do know that you guys are supporters of physical activity and health, and it's an honor to be with the crowd like that, but also stress relief. I hear you there. Going for my walks is my mental stability. So thank you so much. We have another poll later. This is my way of getting to know y'all. So thank you so much. But that kind of lets me know who's in the room, and I appreciate that. All right, so I did give you guys a little bit of a preview about Active People Healthy Nation, but this is our way of recognizing the benefits of physical activity. And that's why we created the Active People Healthy Nation national movement. And our goal is to help 27 million Americans increase their physical activity by 2027. Among our funded recipients from the Division of Nutrition, Physical Activity, and Obesity, this is the overarching brand promoting activity-friendly routes to everyday destinations by using built environment and land use interventions to do that. So we're creating spaces with activity-friendly communities, and that's our way of really helping people reach the goals of increasing their physical activity. Now, for substantial health benefits, given the crowd that I have here today, I don't think this will be a surprise to you, but for substantial health benefits from physical activity, adults should do at least 150 minutes, that's 2 hours and 30 minutes, to 300 hours, not 300 hours, 300 minutes, which is about 5 hours, a week of moderate intensity physical activity. School-age children, on the other hand, and adolescents should get 60 minutes or more of moderate physical activity a day. So essentially though, adults should be moving more and sitting less throughout the day. Some physical activity is better than none. And adults who sit less and do any amount of moderate to vigorous physical activity gain some health benefits. So this is the second edition of the physical activity guidelines for Americans, and you'll see it broken down by the ages there. So I mentioned you want to reach these guidelines based on benefits. So what are those? So this is what the science says. The new findings are highlighted here in blue, and they show you that physical activity has benefits that make you feel better today, now. So in other words, physical activity makes you feel better today, tomorrow, and even 10 years from now. So we see benefits across the age spectrum and across the lifespan, which is really amazing. And this is just to name a few, I will say. We could go on forever talking about all the wonderful things about physical activity, but I like to highlight this for these immediate benefits that happen the minute that you engage in the activity. All right, so then we also know that there are community benefits from physical activity. Activity-friendly communities can have economic benefits and support neighborhood revitalization. They can sometimes improve safety in removing barriers to being active. And because people who are physically active tend to take fewer sick days, we also know that physical activity can improve productivity. So while research tells us that activity-friendly communities improve these things, we do actually have a little problem, and I'm going to show you that. Yeah, unfortunately, the problem is that most people don't get the levels of physical activity that they need to experience all of the benefits. About 31 million people get no physical activity beyond what they need to live, like getting off the couch or going to the fridge or like the kitchen. That's what I do sometimes. But only 1 in 4 adults fully meet physical activity guidelines that I shared on the previous slide. So that's a really interesting predicament that we have in as a nation, and that's why we're all here to help. Okay, so the good news is that part of Active People, let's see here. Yep. We always like to highlight this. Let me go back. I think I skipped one. Yep. The good news is that part of Active People, Healthy Nation, we are highlighting all of the evidence-based strategies that work to increase physical activity in communities. So in the chat, I'd love for you all to put any of the strategies that kind of stick out to you. If you have any of these that are part of your physical activity plan or that you see as priorities, and you'll see at the base of the strategies here, this is kind of our core strategies for Active People. You'll see that equitable and inclusive access is the foundation for Active People. And one component of this is authentic community engagement and using data and information to identify groups of individuals or geographic areas that don't have equitable access or experience greater morbidity and mortality rates. So however, we acknowledge that these are not enough to remove all barriers, but we do know that that is a key component of Active People. So you'll see the strategies there, and it really is about making sure that everyone can reap the benefits of physical activity. And so we always like to highlight important topics and initiatives in our Active People Healthy Nation newsletter. We send this out monthly. And because well-documented disparities in physical activity exist, it is critical to identify and address barriers that cause disparities, and we are committed to understanding and sharing what approaches are needed in order to create access to safe and convenient opportunities to be physically active. And a lot of people that engage with Active People use the hashtag Active People to share that. And in the newsletter, we highlight communities that are doing work to implement the strategies I just shared. And we also share new tools and resources from around the country and from our partners. All right, so in addition to the focus of equity and inclusion, CDC is focusing right now mainly on the routes to destination strategy, and you'll see that highlighted at the top. This is really kind of the driver of what Active People Healthy Nation was originally based on. And it comes from the science. So the Community Preventative Services Task Force recommends built environment approaches that combine one or more interventions to improve transportation systems, and that is combined with one or more land use and community design interventions. So translated, that means activity-friendly routes, which you'll see on the left side of the box, and then that's connected with your everyday destinations components, and that's on the right side of the box. And this is what the science tells us that helps to increase physical activity in communities. And you'll see in the components of each approach in the two columns, but it is the connection between the two sides that is key to increasing physical activity. You have to have that combination of routes plus destinations. So why is that the case? Well, this is actually the strategy that CDC is funding our recipients to implement, and that's kind of the core of that work. And why? Well, people report reasons for not getting enough physical activity, and they often say they don't, one, have enough time, or two, they live in unsafe places or don't have access to physical activity. So thinking about your surrounding space is really important when we think about what the community needs to help people increase their physical activity. And building a national movement that creates a culture of physical activity is the only way that we can give people the life-changing benefits of that whole list of physical activity benefits that I shared earlier. So in comes the strategy that we have throughout the CDC's Division of Nutrition, Physical Activity, and Obesity. And we fund state and local governments, land-grant universities, and their county extension services, and community organizations to promote healthy eating and active living through our three key programs. And you'll see them listed here. We have friendly acronyms for SPAN, HOP, and REACH, but really it comes down to the same strategy for physical activity, which is that connecting activity-friendly routes to everyday destinations, and that's working with cross-sector partnerships to do that. Now, DMPO, Division of Nutrition, Physical Activity, and Obesity, CDC loves our acronyms. I'm sure you might be well aware of that, but DMPO is committed to translating the science into practice. And we provide implementation support to our division's funded recipients and other communities funded by our partners, as you see many of them here on this slide. They bring a wide variety of field expertise and insight to the work, and depending on practitioner needs, we match technical assistance providers with our funded recipients, and we all work together to support the implementation of their action plans when it comes to the built environment to support physical activity. And here's the fun part. So they actually have their own website, and it's called the Physical Activity Partner Network, for Active People Healthy Nation. And this is a place where they amplify the work that you do, and such as reaching partners and other sector networks that you may not normally consider reaching or communicating with. So this partner network website houses all the latest resources for researchers and practitioners working in communities. And that is super fun. So you'll see the link at the bottom, and I highly recommend checking that out. It's a great kind of first stop to see what the network of people that have similar goals and strategies are doing. All right, so before we go on to the next part, I told you I have another poll for you guys. But this one really dives So I think we've got the poll going. I'm looking for a thumbs up here. We're gonna do the next one. And perfect, thumbs up, that's great. So this question really comes down to your partnerships that have helped your community increase physical activity. And I'm really curious, you'll see a bunch of options listed there. Go ahead and select all that apply that you feel have been really instrumental in moving the initiative forward for you that supporting physical activity in your community. There's again here once we close the poll, but you'll see a lot of sectors and a lot of options listed there. All right, let's go ahead and select your final choices here, and we will close out the poll.
Hi, Kelly. It looks like we've got an overwhelming #1 choice again, and that is community, recreation, fitness, and parks at 53%.
Wow, oh my goodness, that's amazing. Okay, great.
There's a couple others hovering right around 10%, which is land use and community design and public health. And then there's a couple others. And then I guess we have votes in every other, just about every other sector, but they're just one to 5.
No one can beat that 53%, huh? Okay, no, that's great. Awesome, that's really great to hear. Thank you for sharing that. And you'll see all those sectors there. Now I did that because those are all sectors listed in that option. We're part of sectors that have worked on the Active People Healthy Nation strategies. So this is really encouraging to hear that you have voted for a one and all. So we'll move on here. Obviously I asked that question because collaboration with partners is essential to helping get that 27 million Americans more physically active by 2027. We envision vibrant, thriving, active communities where you live, work, and play. So that is really all about safe and convenient opportunities to be physically active. But public health cannot do the work alone. And that's why I'm honored to be here today among all of you who recognize the power of collaboration and cross-sector partnerships. I understand that we have representation from people in healthcare, land use, community design, education, parks, it's really exciting to hear places that share this vision and understand that the collaboration is really key. Now, soon I have a screenshot here. Soon our Active People Healthy Nation website on CBC will have a whole section of materials that are devoted to outlining cross-sector examples from real-world communities and also resources that are really focused on helping those specific sectors think about their role in increasing community-wide physical activity. All right, so to start today, or not to start, we're in the middle of this here, to highlight examples that are doing this, I'm going to share a few stories from the field that are related to that connecting activity-friendly routes to everyday destination strategies. So first, we have a collaboration with healthcare, and this comes to us from Blue Cross Blue Shield of Tennessee. And they decided to consolidate operations into a single headquarters. And when they did that, the company recognized an opportunity to create a new culture of health. And it was really geared toward improving employee lifestyle behaviors and reducing demand for healthcare utilization. So they sought to emphasize a sense of connectivity to the nearby community of Chattanooga as a whole and incorporated a shuttle bus system to the downtown area that enhances access to the new headquarters site. Access to the shuttle bus increases the ability of building occupants to move about the greater Chattanooga area. And at the new site overlooking downtown Chattanooga, there are 5 buildings, and they radiate outward to a central plaza, which also provides shaded recreational space and an origin point for the network of running and walking trails on the campus. So if you think about that, it really involves green spaces and winding walking paths and between the buildings. So it's creating that connection from the downtown area, the routes to destinations, but really working with the healthcare sector as a hub to that work. All right, and then also, so then we're gonna look at a land use and community design. And I remember seeing in your poll results that that's something that you feel has been very beneficial to your work. So this example comes to us from Greenbridge, the Greenbridge Master Plan in King County, Washington. And this includes innovation in using active design strategies in site planning for housing mixed with recreational facilities. An innovative demonstration ordinance supported by King County enabled a number of variances to land use and building codes, and that allowed for several alternative design solutions to achieve affordable housing in a low impact development. So really that collaboration allowed this unique community to form and creates this affordable housing structure as well in a walkable, activity-friendly area through the master plan innovation. All right, so let's go on to another sector. I know that we had some votes for this one, but this is in a collaboration with education. And this is an education partnership as we head to Sergeant Bluff, Iowa. A walkability audit demonstrated problems with common routes to schools, which prompted the city to create sidewalks, move stop signs, and add sidewalks. As a result of this experience and the community's desire for sidewalks, the city also made a requirement for any new developments. And this is a fantastic example of safe routes leading to broader community change. With people from different walks of life championing the effort, volunteers soon showed up from unexpected places. A church even got involved in repairing an existing sidewalk, for instance, at no cost to the city or homeowners. A local business also coordinated the project and donated labor, supplies, tools, and equipment for the job. A local concrete company provided concrete at cost, and the church paid for the concrete. So it really highlights the importance of starting with those quick wins, get the community involved and engaged, and the schools are what sparked the jump to community changes. So it can all start by assembling a group of people who have a passion for the community and making improvements. I think that's just a really inspiring example there. All right, and then finally, my 4th example for today is a collaboration with the top winner, the 53%er, the Parks and Rec folks. And so this takes us to New York City in Brooklyn, Brooklyn Bridge Park. The area was formerly an inaccessible cargo shipping site and was owned by the Port Authority of New York and New Jersey. But after a series of community planning workshops, a conceptual framework was developed for a waterfront park. Amenities span from high-intensity sport courts and dynamic children's jungle gyms to flexible use lawns and relaxing gardens by the water. And that's all combined with a schedule of cultural events, environmental education, and fitness classes. And it really is this wide range of amenities and programming that allows people to customize their visit and meet their needs. So those are just some high-level examples of how cross-sector collaboration has worked to foster activity-friendly spaces and places. All right, so I know that we all are in difficult times, which is why I'm here with you virtually, and we want you to be aware that we can be a resource for you in this physical activity and active community work. We will highlight resources and examples through our websites for Active People Healthy Nation and also that monthly newsletter that I shared earlier. There are a lot of engagement opportunities and networking that will happen in the coming years. So right now we have an opportunity for you to join Active People Healthy Nation. And what that essentially means is if you are an individual, if you are a community organization, or if you're a community champion, like an elected local official, you can join and support this movement. And then you'll get the monthly newsletter and be aware of all of the special events and networking opportunities to come. So that's really great. So we really want you guys to engage with this initiative. I feel like you're already on board, given that I was around people that make physical activity part of their everyday, and so do we. So I'm really excited to have you learn about this effort and join us. So there's the contact there. You'll see the CDC obesity Twitter handle. You also can check out the hashtag to see what our Active People Healthy Nation network is saying and doing. We have a collaboration right now with Move with the Mayor. And so a lot of mayors are posting about their active community supports and strategies and using the hashtag Active People. You can also email us at activepeople@cdc.gov with any further questions after today. But I really encourage you to check out the website at cdc.gov/activepeoplehealthynation, and all the information is there, and we're adding stuff every day. So yeah, I'm really, really thankful for the time, and I would love to open it up now. I believe we have time for some discussion and Q&A, but thank you so much.
Thank you so much, Kelly. What a great presentation. Yes, we have time for Q&A. So we've got about 10 or 15 minutes allowed for this. So your mics are muted. So if you could put your questions that you have in the chat box, and we'll work to relay those to Kelly. Yes, thank you. Virtual applause for everyone. Thank you so much. While we're waiting for people to put in questions, I've got a couple. And the first is the obvious one, which is right now in our communities, we're facing lots and lots of challenges, from obviously the COVID-19 pandemic to lots of very long overdue discussions about equity in our communities. So how do we make the case that physical activity is a priority right now?
That's a wonderful question, Robin. And it's very interesting to work right now in public health, because we're also living the thing that we're trying to solve and to improve. So as a community member, I feel that as well. Really, it comes down to the benefits that I showed for physical activity. We hear a lot of people looking for ways to be active in their community, to have the stress relief, to have the mental capacity. You'll see a lot of those benefits haven't changed. That's still the case. And I've actually heard from some of our recipients that there's even been more of a focus from their local leaders that they want to create more safe places to be active. We do have a section of the physical activity website that talks about being active while socially distant. And so you can go there to look at the guidelines and make sure that you're being safe, but also it's not saying that being active is not a priority for your mental health and your physical health at any time. That's still very important for us. So I would just encourage you to go there and check that out and follow along for folks that are working in their communities to create those spaces and access currently, and also doing some virtual things. So I've been encouraged by our recipients that are still focusing on the built environment and recognizing that we're spending a lot more time in our communities. So we have a voice to engage, in what we want to see as we go forward.
Yeah, that's a really great point. I know in Kansas City, the city acted very quickly to close off certain roads to make them spaces for physical activity. So we can be active outdoors while practicing safe social distancing. And, closed streets are a great opportunity for that. And, it's our hope, and I think our challenge is to make sure that once we get through this pandemic, that those changes that we've made can be made permanent, or at least there's a more formal structure for creating those opportunities in our cities. We've got one question so far in the chat, and it is related to grant funding. So what sort of grant opportunities does the CDC have? Is it for programming or physical infrastructure?
Oh, perfect. Yeah, so that actually is all. We have a whole branch within the Division of Nutrition, Physical Activity, and Obesity that is all about administering the support to states and communities. And that's the 3 different funding lines that I showed. So we have our state level, our SPAN, we have our HOP, which is for the universities, and then we have REACH, which is for local communities. But that is all right now. It's a 5-year cycle and we're going into year 3. So there's 62 recipients of that funding, but really it's the physical activity strategy is all about having public health collaborate with other partners in transportation, city planning, and a lot of the main action plans right now are intervening in master plan and ped and bike plan. So it's not necessarily paying for the infrastructure, but it's all about the support to make the policy and system level changes to make that happen. And there actually is a whole website, and I can provide this to Robin to share out later, but there is a website on CDC that has a profile description of all the states and communities that have that physical activity funding and a little brief description of what they're doing. So it's really encouraging. I see everything from working with the city planning, but then I also have some folks that are working with trails and the Parks and Rec that seem to be really popular with the response among you all. So lots of different examples of that funding being put to use.
Great, thank you. While we wait for more questions to come in the chat box, I really loved your examples of communities that are using these collaborations to make changes in their environments. And you had a lot of great ones in there, and some of it seemed to come from the top down, from say, a city hall or a county or city health department, but others seem to rise up from the bottom. So, you know, maybe a community organization, I know you mentioned a church at one point, work to create safe routes to school. So can you just talk a little bit about, you know, whether, what are maybe the pros and cons of doing each of those, you know, kind of ground up initiatives or top-down initiatives? Certainly, I think what we're trying to do is kind of a ground up initiative with our Kansas City Physical Activity.
That is really cool. I think it, you know, the short answer is I see it work both ways. The long answer goes a little bit more in depth of finding that common ground. So one of the main examples of that ground up approach that I see really being successful is when it is a community-wide engagement and then they're showing quick wins. So we call them, or, you know, through quick builds or demonstration projects and things like that, or possibly even what you described, Robin, with the open streets during COVID. Evaluation is really important because that lets you see progress and then showcase that change to other decision makers. And so the most, you know, successful projects I see is that they implement a change and they show some sort of actionable thing that changed or improved through physical activity, whether it is, you know, less traffic incidents or a safer walk to school, more kids walking and utilizing that path. It's those being able to evaluate and show changes when you go from that ground up approach, because that's really how you highlight that this should become more of a priority. And that's what I see typically. From the top down approach, that's typically because they now have a line of funding in their master plan, or they have a new partnership that is facilitating that. And again, it's all about having those champions that are recognizing the benefits and the changes that can happen in the community. I think it's really inspiring both ways.
Great, that's great. I really, you know, what really stood out to me was your comment about evaluating these projects as they happen. The project that I mentioned, you know, a minute or two ago about in Kansas City, we closed down some streets to create opportunities for physical activity in the streets. Those actually went away this week because of various other needs of the city. And when I was talking to a city council member about whether they would come back, he said, man, I wish we would have built in evaluation or counting of use of these streets when we did this. So we could take this back to the city that, yes, these are an overwhelming, popular thing in the city, because city council members, they often only hear from their constituents when there's a problem. They are, they're often the head of the complaint department, I think. We had another question pop up, and that is, And it's a really good question. I know it's something that we're dealing with in Kansas City. How do you balance physical activity infrastructure improvement with the preservation of affordable housing so it doesn't turn into gentrification and push people out?
That is an incredible question, and it's something that it is a main priority in my branch. In the past couple of years, we've actually been doing a lot of gray literature. So not necessarily even in our published peer-reviewed literature, but looking at gray literature to look for strategies and kind of practice-based evidence of what is working to mitigate the negative effects that can happen. So that is a big thing. We study constantly the gentrification and displacement. And we've also looked at strategies that communities are using to reduce the negative effects. I wish I had all the answers. I don't, but I know that it is something that is a key priority for everyone in this area. And I've actually seen some communities where they've been successful in mitigating that. For example, one of our main recipients, or one of our funding recipients right now is a group in Savannah, Georgia, and they're working on a project called Tied to Town. And it is essentially a trail network that expands outward of the downtown Savannah area into more of the rural outskirts. And there was a lot of concern when they were making those plans from the residents that exactly that would happen, that their land would cost more, that the housing would be less affordable and things like that. And they've done a few things to maintain the area and keep the integrity and the people who live there. And I think that that's the type of project that I love to see happening, and we're learning more from them every day. So I don't have the answers, but we're so happy to be able to have that be top of mind and something that a lot of our communities find also as a priority.
Yeah, it's a really important topic. We're getting some great questions. Here's another one. You mentioned safety as being a barrier to people being physically active in certain communities. Do you have any examples of projects that have been completed where safety was an issue or barrier and the project helped address physical activity and people feeling safe?
Yeah, so safety can mean a lot of different things to lots of different people, and I know that as well. And when we think about equity as the foundation of Active People, a Healthy Nation, we're exploring all aspects of safety and what that means to certain people. So there's several different examples from that, but I will draw from most often among our funded recipients when safety is part of their work plan. It relates to traffic calming around school areas. And so that often is what drives enhancing or improving routes to school that children can be physically active, because it might not be safe to right now, to be able to walk and bike to school. So a lot of times our recipients are working with partners at the Safe Routes Partnership, and they're also working with law enforcement to study traffic casualties and traffic incidents that are happening in the area that they're working to improve. So that's a great example. And a lot of times it happens to start by these pop-up demonstrations to see if, one, if you're increasing use of the route, and two, decreasing incidents. And that can often show to, like we were talking about, to local decision makers that this type of improvement will improve safety for the children going to school. So that's just one example. But a lot of times it comes down again to evaluation and being able to have indicators that show progress.
That's great. Yeah. Another great question. Cross-sector collaboration comes up time and time again. What have you seen from a community engagement perspective? Do you have any tips on engagement, managing engagement, etc.?
Yeah, so community engagement is so huge. We actually, on the Active People Healthy Nation website, one of the main resources is an action guide for implementing routes to destinations. And you'll be happy to see that one of the major things is coalition building and community engagement. So we've seen a couple different tools. Now, obviously during COVID, a lot of our recipients have worked out different ways to be virtual. But the kind of most fun example I can share that I saw recently was that they wanted to continue doing walk audits, because that's a really good way to engage your community and give a voice to people who are actually using the streets, the paths, and that kind of thing. But during COVID, they couldn't have people gathering and doing the walk audits as normal. So they actually had a volunteer program where people could report and submit their own, they're out walking or biking during the day, and they could report their results. And it was the community forming this idea of where the intervention areas should be and mapping out where they wanted to see enhancements and improvements. So that's a COVID innovation that I just saw. But I think that having the community involved in the initial assessment and deciding what routes and what destinations need to be improved and why, that's a really key step in deciding where you're going to improve the infrastructure.
Yeah, that's such a great tip. And like nothing gets someone engaged more than actually being out and experiencing their environment, firsthand. And it's great to see, that there are creative ways to do this during COVID-19. So.
And if you hear of any, please let us know. We're always welcoming innovative ideas right now. So it's been fun to have those come in from communities across the country.
Great. And so before we're at the end of our time here with you, Kelly, what's the best way to track these types of things that you mentioned? Do you have a website you'd like to send people to, or?
Yeah, the best way to do it right now is the screenshot I had shown, but on the Active People Healthy Nation website. To join, click the button, join, put your email address in. You will be part of all of the communications, but it's also a two-way communication loop. So when you join as a supporter of Active People Healthy Nation, then you get the newest resources. You're the first to know about webinars or networking calls. And you also have an opportunity to submit stories and successes from your own work. And obviously we know about what's going on in Kansas City because I'm here with you today. So I've been sharing a lot back with my team. But as you go forward, we're super curious to hear if you have challenges or successes. That's important to share as part of this network and a part of the national initiative.
Great. Thank you so much, Kelly. This has been a great presentation and great conversation. And we put all the links that you mentioned in the chat box so people can find it there. So one last time, big virtual applause for Kelly Cornett from the Centers for Disease Control and Prevention.
Thank you all.
Great. Okay, so now we're at 11 o'clock and we're going to start our second breakout session.
Okay, I think we've all made it back to the main session. I'm Shelley Summer again from the Weighing In program at Children's Mercy. I hope you all had a chance for some excellent conversation. I know we did. There's a lot to think about here in terms of the sectors, and not just the individual sectors, but how do our sectors work across the settings to move this work forward? How do we think about our strategies and tactics together? And so with that, what we'd like to do for this next session is get a little bit of an update from each of the different sectors on the conversations that occurred today. So what are the highlights? What are the takeaways? What are the things we want to think about here? So I'm going to turn it over to Emily Meisen-Sebelius, also from the Weighing In program, as she leads us through the different sectors and the sector updates. Emily?
Great. Can you all hear me okay? All right. Thank you, Shelley, and thanks everyone for being here and hanging in. We so appreciate your participation today. We hope that we've given you some chances to interact and also to visit other sectors. As Shelley said, this cross-sector collaboration was a big goal of our meeting today, and that really came from our core working group, our leaders that you all met in your sector breakouts, trying to think about how we get out of our silos, how we use this opportunity to come together. So right now, what we'd like to do is call on each of our sector leads to report out to our main group. We're back here in our main group. I think about this as if I'm in a big room in Kaufman and it's our time to do our reporting out from our table conversations. And so we're going to turn it over to each of our sector leads to share a few of their highlights and takeaways from the breakout sectors so that we can all, again, hear from one another and think about those ways that we can connect across sectors in this process. So I'm going to start out with our Healthy Schools sector. That sector is led by Michelle Dake from KC Healthy Kids. So she's going to share the highlights from the day from the Healthy Schools sector.
Hello, everyone. So highlights from our breakout sessions was really a lot of passion for one of the strategies within Healthy Schools, which is creating more opportunities for physical activity breaks and the more non-traditional physical activity throughout the school day for students. So whether that's activity clubs, physical activity breaks, music and movement, having students create their own games, and then how do we remove barriers for teachers and families for being able to use those during the school day. Really, especially with the focus on this fall with schools being virtual, that knowing, asking teachers to incorporate something new is an even bigger ask than it has been in the past because everything feels new at the moment. And then also providing resources for classroom teachers to teach their traditional content in a physically active way as well. Another great highlight that came, kind of a new idea from the day, is creating some shared programming between Healthy Schools and our healthcare groups on ways that pediatricians can refer their patients to programming that's already happening at their school. So, and vice versa from schools to healthcare. So when students are doing their well checks or their physicals and they're engaging with families, they have something they can refer them to at school that's happening. We also talked a little bit about who's been missing from our sector. And one that popped up that but then quickly moved on was family engagement and how that feels like it's even more of a priority now because parents are the co-teachers in a virtual school setting. So really making sure we're supporting families and engaging families, even though this group is focused on a K-12 setting, how do we get that buy-in and support families? And then another great stakeholder, which one we hadn't thought of before, was reaching out to employers of students. So thinking at the secondary level, who is employing a large amount of the students in school districts and how they might be able to support initiatives at school or support their employee wellness, then affecting those high school students in a positive way as well. So thank you for the great discussion, and we have a lot to bring back to our work group moving forward.
Great, thanks so much, Michelle. Sounds like a lot of new ideas and a lot of opportunities for that cross-sector collaboration. That's terrific. Next, we'll move on to the early childhood sector. So Rhonda Erpelding is going to share some highlights from those breakout rooms. Rhonda, you think you're muted. Oh. Rhonda's still muted if you can hear me. There we go.
Can you hear me? Okay.
There you go.
Thanks, everybody. It's a great opportunity to give you some feedback on our sessions that we've had this morning and how it's going to help as we move forward with our physical activity plan for the early childhood sector. So some of the takeaways that we had were around prioritizing our tactics. And it really resonated with the group that we needed to prioritize developing or selecting the standards around standards for physical activity in the setting, and really looking at that to be kind of spearheading the next steps and the next priorities of the tactics, especially as we think about professional development for the providers, and then following back up with best practices, and then fourth but not least would be around family engagement. Some of the other highlights that we had is that we really need to make sure that we invite to the table and really try to increase the engagement is from the providers. So looking at the early care and education professionals, whether it be teachers, assistant teachers, the cook, the director, really making sure that we invite them to the table to really help design and implement the plan going forward. Something else that really resonated to the top is that the tactics that our group have selected so far and that we're going to move forward with, they really complement each other. They work together to form a really comprehensive strategy. And so prioritizing our tactics and moving forward, it's really important that we embed family engagement across those tactics. That's something that in our cross-sector group really stood out to as well, is just the importance of family engagement and how moving forward with the tactics and the implementation of them is that we really want to be able to get family buy-in. And then also in our second group around cross-sector, we identified that faith-based setting would be a great sector to collaborate with. Families are going to faith-based settings. They often rely on that sector for education and information. And so it's a great opportunity that we're going to look into on how we can cross-collaborate with them and move forward our tactics and our plan to be implemented.
All right, terrific. Thank you, Rhonda, for sharing the highlights from the early childhood breakout sessions. Really appreciate that. Next, we'll hear from the infrastructure group, and Laura Steele is going to share highlights. Laura Steele from Bike Walk KC is going to share highlights from that group.
Hey, everyone. From our first breakout group, we did a review of our process of how we arrived at our infrastructure priorities that we are looking to put into the plan. And I had our group do a little exercise where they helped us rank those priorities. And so, coming to the top of the list, and I can hear it echoed in the other groups, is, community engagement. So we know that's a priority. And as we move into the next step of finding strategies and tactics to really hear from the community to inform infrastructure projects and policies, this is definitely something that we're going to keep top of mind. We also had discussions around obviously COVID-19 and how people are utilizing infrastructure, but also there's a lot of challenges, out there as far as say like land use policies and not being allowed to use things like schools as parks after, during COVID and whatnot. What else? We had some good discussion around environmental justice. So one of our priorities was around activating unused spaces, and how might we look at that also as an opportunity to beautify the area and maybe do some mitigation of congestion and things like that by the way that we utilize that vacant space. And then our second breakout group, again, we recognized some of the different groups who would be really beneficial to work with, particularly the faith-based sector. I think Kelly had mentioned that as well as an example of a good partnership where the church was helping to build sidewalks and whatnot. So, our partnerships need to be strong throughout this, and we really need to understand, how we can utilize those partnerships to the utmost, because we never know where our champions are going to come from. The infrastructure is everywhere around us, and so we really need everybody's voice in that conversation.
Terrific. Thank you, Laura, so much for that summary. Really appreciate it. Sounds like a lot of great discussion. Next, we'll move on to our healthcare sector, and Dr. Jody Dickmeyer from Children's Mercy is going to give us a summary of those groups.
Yeah, thank you, Emily. So what we talked about, first of all, in our healthcare sector was the 4 strategies that you have in front of you, and how we had sent out a survey to other healthcare providers trying to figure out what our first 2 or top 2 strategies are currently, so we can start aiming or getting some tactics for those. So if you look at your screen, the third one, the partnering with other sectors to promote access to evidence-based physical activity, was our number 1. And then the first one on your list, the increase the priority of physical activity assessment, advice, and promotion, was our number 2. And those are pretty hand in hand. And, you know, talking with everyone, it seemed like those were also a main priority for our healthcare sector. We talked about how we discuss this with our families. We talked about 1, 2, 3, 4, 5 Fit-tastic, which is helping kind of get a report card or a scorecard of how our patients are doing right now. And that's a jumping off point for talking with them in our clinic setting. We also talked about how we discuss this with our families, and not necessarily focusing on the physical activity, meaning that they are physically active in sports, but like, how are they doing their physical activity? Are they working on strength training? Are they working on jumping and lifting and moving their body, and not necessarily how many sports they're involved with? We talked about the duration of physical activity, not necessarily needing to be an hour at a time, but 10 to 15-minute bursts of physical activity is what we really want for our patients at a time. We talked about, both in the healthcare and our cross-section or our cross-sector work group, about giving a prescription for physical exercise. So some physicians will give an actual paper prescription, but we're also talking in our cross sector about making it part of the medical record, something that we can track longitudinally to see if this is actually working, or if families are actually achieving these goals or not. Some of the other stuff we talked about in our cross sector work group was something called the CHAMPS program, where they are pairing with first and second year medical students to help provide increased education for those medical students, and also trying to get the medical students into the communities to see how these patients are living and what they have access to. We talked about parenting support is a big one. As everyone has probably been seeing, there's a lot of parent stressors with online school and trying to get kids active and out of the house. We're not driving the parents crazy. So trying to have some parenting resources as well. And like we said, physical activity helps reduce those just stress and anxiety. So making this a everyday living is going to be really important for those families. And then obviously with the healthcare sector, we have to partner with our infrastructure communities, Bike Walk KC, you know, having kids have a safe place to walk to school, to bike to school, to have access to bikes and bike helmets. So all that safety stuff is really near and dear to, you know, pediatricians' heart. So we had a lot of good discussion today.
Thank you so much, Jody. That's wonderful. And, you know, Kelly talked a lot about how are we tracking and evaluating so we can show that progress. And that's one of the things that I heard you all talk about that haven't heard on the other groups, and what a great idea for all of us to be thinking about that longitudinal, or that way of tracking and evaluating as we're building in our plans. Thanks. And so many other good things too. Thanks so much. All right, next we're going to move on to our Parks and Recreation sector. So we'll turn it over to Jen Jute, who's from the Kansas City, Missouri Parks and Rec Department.
Actually, I'm going to take it for Jen. This is Roosevelt.
So sorry.
That's all right. That's all we deviated from the plan.
No problem. Thanks, Rose. So Roosevelt Lyons from KCPA Parks and Rec. Thanks, Roosevelt.
Yep, no problem. Roosevelt Lyons, Deputy Director, Kansas City, Missouri Parks and Recreation. So this was actually the first meeting of our sector. So we spent a lot of the time talking about the strategies, getting people caught up to speed on the strategies, kind of on our timeline and meetings kind of going forward, and also opening up to some conversation. So through those conversations, we heard about the need to make sure that we're focusing on not just parks themselves, but all of the things that connect people to parks, whether those are sidewalks, whether those are roads. We also heard about the need to think about this as a kind of a metro-wide issue and kind of try not to get so involved, not so focus on just those parks themselves. So expanding kind of the conversation to include all the ways that people interact with parks. Equity, of course, was a issue that came up, and how to make sure that people have equitable access to parks and services. We also dove a little bit into some of the budget issues that a lot of not only parks departments are having right now, but a lot of the agencies who have a similar mission are facing right now, and talked about some approaches, whether that's looking at your budget through priorities, or looking at partnerships, more partnerships to build capacity, and to share some of those costs. And we have some good examples of that as well. I think those were the main things that we touched on.
Great, thanks so much for sharing that. Sounds like really great conversation that includes some of those high priority things for the KC Physical Activity Plan, like equitable access. Next, we're going to move to the faith-based sector, our last sector for today, and Shelley Summer is going to share the highlights from that sector.
Thanks, Emily. Yes, this was our first sector meeting as well, and I'm just thrilled to hear what the others have shared about the discussions going on in their sector breakout groups, because it aligns so perfectly with what we're saying. So cross-sector information is so important to include in the final plan. Including those in tactics is going to be super helpful for actually implementing some of these projects. And I heard family engagement mentioned, and that makes so much sense in faith-based settings. Rhonda talked about early childcare. We talked about that as well. How do those work together? So in faith-based settings, you often have childcare going on during services. How do you incorporate physical activity into those pieces? We also talked about schools or youth sports. How do we incorporate physical activity into the youth activities in faith-based settings? And I think Laura said infrastructure is everywhere. It is. How does that or partnering with infrastructure sector help improve physical activity, whether it's to church activities, or other projects or programs that are going on? So lots of opportunity for cross-sector work there as well. The other one, and I thank Helena for joining us in our sector work. So she's the new medical director for the center. Really thinking about how healthcare, how you partner with healthcare in faith-based settings. There are lots of opportunities for programs that are currently being implemented in faith-based settings to improve rates of chronic disease. So a couple of the things that came out of our conversation were really related to how do we engage others in this work? How do we ensure we've got a diverse population? And thinking about establishing partnerships with those other organizations and how we effectively include physical activity in health ministries, because they align with these other sectors so beautifully. So that was really the gist of our conversation. I'm so thrilled that I heard many of these things being shared in the other cross-sector conversations as well. So.
Great. Thanks, Shelley. Thanks for that summary and making some of those connections as well. I apologize, I left off one group. We did also have a youth sports group that met in one of the breakouts. So Robin's going to just share a brief report out from the youth sports group.
Yeah, hi, thanks. So youth sports is one of the 4 sectors that actually hasn't started meeting yet. It's scheduled to start this fall. We knew that there was a lot of interest in this sector prior to the summit, so we decided to add it just as one breakout session towards the end of the day. And we had a great conversation introducing the group to what the national plan has in the sports sectors. And then we had followed that up with just a conversation of what we thought were important topics. And those were related to things like getting whether sports in their current form are sufficient to provide meaningful physical activity to kids, and if not, why that might be. The discussion then led to coaching and how maybe oftentimes the coaches, especially at the younger levels, rely on volunteers who may not have the training in proper coaching or most effective and efficient coaching to provide, lots of opportunity for movement and activity when they're practicing and during games. There was also a lot of discussion about burnout arising from youth sports and kids focusing on single sports. And I guess my takeaway from all of this was the conversation that we were having organically seemed to align pretty well with what is already represented in strategies and tactics from the sports sector already. So I think that this sector really has an opportunity to create some really Kansas City focused strategies and tactics. So I'm excited to begin the work in youth sports for the coming year. If you're interested in youth sports and you didn't participate in today's breakout session, that's okay. You can go to our website, kcphysicalactivityplan.org, and in the upper right-hand corner, there's a button that says Join a Sector. And you can sign up for the youth sports sector there, and you can be added to our distribution list. So when we start meeting regularly later this fall, we can notify you of when that occurs. So thanks a lot.
All right. Great. Great. Thank you, Robin. That is wonderful to hear from youth sports already well ready to get going. So that's very exciting. And I think a lot of opportunities to connect across sectors. I'm going to turn it over to Matt Kleiman, who's also from Weighing In, and he's going to do a little wrap up for us, some of the highlights that he's been listening to and hearing from across the sectors as we've been taking notes in the background at Weighing In throughout the whole meeting, really hoping to solidify some of these big takeaways and opportunities to move forward, connecting together. So I'm going to turn it over to Matt for our next wrap up.
Yeah, and thank you, Emily, and thanks to all the sector leads. I don't know if folks realize, but they've been doing a lot of the real work of getting organized and getting folks to meetings and really guiding conversations. So thank you to them again. I'll just briefly summarize. I have each of the Weighing In team members has been taking notes during each of the breakout rooms on the back end, and we realized that everyone got to participate in smaller rooms, which might not get the whole overview. And so I've been reading through those notes, trying to recap maybe some takeaways that every sector can kind of take home and think about how the KCPA plan can be helpful. And so I'm just going to go through the same kind of list that we presented in, but kind of pulling out some comments that were made or some references that were made in the notes. And so for starters, Healthy Schools talked a lot about how it's important to include the students and the teachers, because if we're going to do physical activity, it's going to kind of come across as a movement. One of the challenges is that barriers exist when you start talking about strategies and tactics because it can be too formal. And so we talk about KCPA plan as having priorities, but the group itself mentioned how we need to be making sure that this work is done informally and it's introduced in a way that's accessible. And related to access, the group also talked a lot about how we can make sure that we're addressing the fact that there's inequality in schools, that not every school is starting in the same place. So when we're talking about physical activity, we want to make sure that we're meeting people where they are and we don't increase health disparities in this work. Early childhood added that tactics are not standalone. Like this needs to be not one tactic versus another, but they needed to be thought of as a kind of a comprehensive strategy. And that the KCPA plan really can serve as a great way to have that discussion about how these tactics can be really thought of as a larger strategy to improve physical activity in places like early childhood, but probably every sector as well. For infrastructure, there was a big emphasis on how community engagement can be improved, especially public outreach, and that environmental justice also needs to be a concern because not every place is going to be safe for physical activity. So we need to do a better job on improving health and activating unused spaces, but that there needs to be a concern also about areas that maybe just aren't quite safe, and those areas might need a higher prioritization. Building networks of areas where we can, work together across different parks or trails or sidewalks so that it's more equitable is something that's been brought up in past infrastructure sector worker meetings. The group also mentioned today that there's a lot of resources available on this. So how does the KCPA plan lift up those resources and align its priorities? For healthcare, I saw a lot of comments about just the need for better assessment of physical activity. And I know you heard it before with Jody, but the idea that sports is not enough. Physical activity is a more holistic conversation that has to be had. And so how do we encourage people to be physically active without just expecting that they commit to a sport? And so that's going to require building partnerships. And I know Bike Walk KC was mentioned. What other partners might exist with the healthcare sector so that the assessment on physical activity is more than just join a sport? For Parks and Recreation, that was the sector work group I supported with Roosevelt and Jen. Brought up a lot of actual interesting conversations about state level recommendations. We had folks from Missouri Extension and all the way to Chinook, Kansas, talking about how the states might be interested in taking some of the recommendations from the KCPA plan. So the conversation was about policy, but as Roosevelt mentioned also, there's also a lot of local prioritization, especially with COVID, but also after. How will we prioritize the resources and services for residents so that they can be physically active at low cost in an equitable way? So again, you're starting to hear some of the same themes. For the faith-based sector, I saw a lot of comments that there is a need to be intentional in how physical activity is promoted, because the faith-based settings are great places for camps and sports activities. It's a great opportunity, like healthcare, to engage with intentional partners who can help provide some of the resources or spaces or training for physical activity in those larger groups. And we don't have the notes for youth sports because it was kind of an individual first-time approach, but what Robin said I think was exactly right, encouraging and training our coaches to be better informed about physical activity and finding ways to keep kids from getting burned out. So that physical activity is something that's joyful. So this is trying to pull together just a couple of thoughts that are kind of commented during your breakout rooms. I think this is really good as a resource to encourage everybody to be thinking about how you can relate to these other sectors, because we're all dealing with the same challenges and barriers, I think, in a lot of different spaces. And so that was part of the purpose of the summit. We'll make sure to share this note document with you all as a wrap up after the summit so you can see the comments that I'm drawing from and what's been taken. And I think Robin is going to close us out with some final remarks.
Great. Thank you, Matt, for that great summary. And thanks to all the individual sector leads. As it was mentioned, they have been doing a huge amount of work over the past 9 months. And none of this work could have been possible without their involvement. So we really appreciate all that they're doing. So, it's my responsibility now to kind of let everyone know what the next steps are following this summit for the Kansas City Physical Activity Plan. So first of all, again, I've said this multiple times, the place where you should get all your information is at kcphysicalactivityplan.org. And on the summit page on that website, we will have all of the information from this summit posted. Now, we actually already have the notes from the sector breakout session posted up there now. We've got a link to the live Google Doc where we were keeping all of those notes. Now, of course, we're going to be cleaning them up a little bit over the next couple of days because they were made in real time. But if you wanted to see something from a sector that you weren't involved with or a breakout session you couldn't be a part of, please refer back to that and you can read all the notes there. Additionally, we'll have recordings from the main session presentations posted on our website relatively soon. Probably next week, we'll hope to have those up on our website. So if you want to watch those, see them again, please refer to that. I understand, it's always not as clear looking at some of the presentations on your laptop or if you have a bad internet connection, but please go back and re-watch those recordings if you had any issues watching it the first time. Of course, you can also use those to share with your coworkers and any other people who couldn't make it today. There will be additional sector-specific follow-up that may occur via email. And so if you are in, for example, the infrastructure section, you may get follow-up emails from those sector leads following up for more information, whether it's to gather additional information, to ask follow-up questions, or just to report out on the results from the meeting. So that will vary by sector, but keep your eyes open to your email for that. Likewise, if you, after today, decided that you wanted to join a sector, either that's already ongoing or one of the 4 that will launch in the next year, you can go to our website, and as I mentioned, in the upper right-hand corner, you can click sector and join one of our sectors. We already have several meetings lined up over the next 4 to 6 weeks. So if you go to our website and under the events tab, you can find a list of all of those meetings. That's where we track them all. And so I just took a screenshot of what's up there right now, and we've got meetings in Parks and Rec, early childhood, and healthy schools, all within the next 2 to 3 weeks. So go to that page on our website if you want to know when the next meetings will occur. All right, and if we zoom back out, here's a larger look at what we've got planned. The first edition of the Kansas City Physical Activity Plan will be released in late fall 2020. We're going to take all the information and feedback we've gathered from today's summit and incorporate that into all the work that we've done in the previous 9 months, and that will be reflected in the first edition. And the first edition of the Physical Activity Plan will only include the 6 sectors that we've talked about many times today. The new sectors, the 4 new ones, youth sports, mass media, business, and public health, will be launched in fall 2020 as well. So if you're interested in participating in any of those sectors, again, go to our website, join the sectors, and you'll be notified when those meetings start occurring. We will begin implementing strategies and tactics from the first 6 sectors almost immediately. Of course, that involves lots of planning. There may be funding that has to be secured, but we will be taking steps to implement the strategies and tactics as soon as the plan is released. We want this to be a living, functional document. It's not designed to sit on a shelf. We want to actually implement the strategies and tactics that we've worked so hard to develop. So keep your eyes open for work that will be beginning in those implementation later this fall and early 2021. The second edition of the Kansas City Physical Activity Plan will be released in late fall 2021. So this plan will include everything that was in the first edition plus the 4 additional sectors. So that will mean that our second edition is the full, complete Kansas City Physical Activity Plan. Keep your emails, keep your eyes on your emails for updates related to all the planning in the next year related to the release of that plan. And as I've mentioned, this is a living document. We will update it as we feel necessary. We plan on structured updates to occur at regular intervals. So for example, the national plan is updated every 4 years. We may do 4 years, we may do 5 years. And that means reconvening all the sectors, examining all the strategies and tactics to see whether they're still priorities or whether new ones have emerged that we think we need to be at. So that brings us to the end of our day. I think that this has been a wonderful event. We've worked really hard to make it interactive and participatory, and we really appreciate your engagement and involvement. We want to thank our sponsors once again, our primary sponsor, which is the Enid and Crosby Kemper Foundation. We also want to thank HRSA Region 7, and Children's Mercy for all of their support in today's event. Likewise, I want to thank all of the sector leads that have put in so much work over the past 10 months. And I want to thank Tico Productions for all their help pulling off this virtual summit. So thank you, Oscar and Brenna, for all your work in making this happen. So that concludes the first ever Kansas City Physical Activity Plan. Thank you for your participation. Thanks for taking time out of your very busy schedules, your work, your homeschooling of your kids, and everything else that is going on. Thank you so much for all the work that you do in our region to make this a safe and healthy place to live. Now, before we leave, I'll ask Emily to paste our evaluation link in the chat box. It's okay if you don't happen to get to it right now. We will also follow up in our post-session or post-summit evaluation, the link to that evaluation as well. So you can either fill it out today or you can fill it out when we send out the evaluation. Thank you so much for your participation. Everybody be safe. And I couldn't go through the day without raising our Super Bowl championship banner. Thanks, everybody. Be safe and go Chiefs.